I'm Tori Novak, and this is video 3 of coaching spirometry. The bedside spirometer that my site uses is this MedGraphics cardiorespiratory diagnosis box, and it gets plugged into the laptop, which is what we use, by the USB cord. And then it also has this calibration tool. So this will be plugged in. First we'll calibrate the machine. We use the 3-liter syringe to do that and follow the prompts on the screen. So it will tell you to you'll have it plugged in and it will tell you to inject, retract type of thing until the machine's calibrated. And then this is what will attach to the flow sensor. There's that little notch, so you just want to make sure it's on opposite sides. And so it attaches into the flow sensor, and the flow sensor attaches into the mouthpiece like this. And so you have the filter in between there, and this mouthpiece right here is what your patient's actually going to be holding and breathing into. And then they also have these nose clips to help make sure that there's not going to be any leaks. So after you've calibrated your machine, you need to make sure that your patient understands what you're going to be doing. And so you need to introduce yourself, explain to your patient that you'll be doing this bedside PFT because we want to measure their flows, and that you're going to explain to them, and then you're going to coach them through it. So you start off by making sure that you've washed your hands, you've got your gloves on, and that you've appropriately attached your mouthpiece and your calibration tool. Once everything's set up correctly and you have no leaks, you go ahead and begin recording on your computer. It's important to make sure that your patients are sitting upright with their feet flat on the floor, and then you begin instructing them. So for the slow vital capacity, you might say, okay, I want you to take some nice easy breaths and keep breathing just nice and easy, nice and easy. You want 4 tidal volumes, and then you'll say, okay, I want you to breathe in nice and deep, and I want you to breathe in as much as you can and fill your lungs completely full of air. And once you feel like you can't fill your lungs anymore, I want you to slowly blow it all out, and I want you to blow, 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 blow until I tell you to stop, okay? Or until you can't anymore. So nice deep breath in. And then you say, okay, breath out and blow, 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 blow. And I'm watching my screen, and on the expiratory curve, I want to see plateau. And then that's when they can stop breathing. Now, if they're still climbing, it means there's still air in the lungs, and so you want to keep having them exhale, because that way they're getting the air out. So you repeat that test at least 3 times, making sure that your values are within 5% of each other. Otherwise, you'll do more. Then you might do the forced vital capacity. So same process, mouthpiece is in, teeth and lips are sealed tightly around the mouthpiece, nose is plugged, and you're going to say, okay, nice easy breathing, and you're waiting for those 4 tidal volumes, and you say, I want you to take a fast, deep breath in, as much air as fast as you can, and then you tell them to blast it out. So you say, okay, now blast it out, blow, 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 keep blowing, keep blowing, keep blowing, keep blowing, keep blowing. They have to blow out for at least 6 seconds, but you want them to blow all that air out. So that's what's going to help you measure your forced expiratory volumes in 1 second. You're going to have them keep blowing, blowing, blowing. It's good to be kind of like a cheerleader, get a little excited about it. So that's how you would do that forced vital capacity. Then you can do the MVV. And so when you do that, you could do a pre and a post before the bedside PFT. So if that was the case, you would be doing your bronchodilator in between the treatment. But then you could do the MVV. So that would be deep, fast breathing. It's 12 to 15 seconds, and it's sort of like a pant, but it's deep breath. So and you would instruct them, you would coach them, okay, you know, a little slower, a little faster, whatever you need to get those values. Of course, you want to give your patient adequate time to recover between testing. They may need to stop and have a tissue, or they may need to have a little bit of water. If your patient coughs or breathes too early, you may have to repeat the test more than 3 times. It's very common, and that is how you would use the bedside PFT.